Well, I do understand that for the purposes of this presentation, we're looking at enhancing communication through the discharge process. However, I did want to share a tool that has been since implemented recently by our cardiologists to help prevent readmissions. Um, because the onus should not rely solely upon the discharge process, emergency rooms and urgent care settings can institute protocols for admission criteria of cardiac patients. So, the HEART pathway is a decision aid designed to identify patients in the emergency room or urgent care setting who present with acute chest pain. And we're basically trying to either set up for early discharge, discharge home, or criteria that will see if the patient will be admitted for observation or for further intervention. So the HEART pathway, it's basically an acronym. The H stands for history, E stands for EKG, A stands for age, R risk factors, T time and or troponin. And at the end of this pathway, once all elements are evaluated, a score will be developed. So when looking at our pathway here, if, for example, a patient presents with no suspicious history of cardiac events, the patient would get a score of 0. For EKG, if the EKG presented as nonspecific, the patient would get 1 point. If the patient was 65 years old, the patient would get 2 points. If the patient had one or more risk factors, the patient would get 1 or 2 points depending on how many risk factors they had. And if their troponin was within normal limits, they would get 0 points. So on this scoring tool, if the patient presented with either 0 to 3 points, the patient would be discharged home. If the patient scored 4 to 6, the patient would be admitted for observation. And if the patient scored 7 to 10, the patient would definitely need to be admitted with early intervention. I decided to share this pathway with you guys because I felt it was necessary to share tools that are also happening on the front end of admission and potentially which could help to avoid readmissions. I hope you enjoyed my presentation and I look forward to your feedback.